So we get a dispatch call saying we have a person that's been shot in the chest. So we're going to arrive on scene to make sure the scene is safe. Nature of illness is going to be there. Number of patients, additional resources, and then considering C-spine would be my acronym SNACK. So as I arrive on scene, we're going to see if our scene is safe. I don't see any major threats for myself and my partner, so we're going to be okay. We're then going to identify the nature of illness. So nature of illness would be a gunshot wound coming up to this patient. And then the number of patients we have is 1. Additional resources, we might need additional resources becomes a bigger issue, maybe internally. So I would not do it right now, but if we need it, we will. And then considering a C-spine, my partner would actually get towards the patient's neck and stabilize her spine. That way she doesn't have to roll her neck very much. So once we do that, I'm going to approach the patient. I'm going to identify a nature of illness, which would be a bullet wound. I would then see if she's conscious or not. So I'll go, hey ma'am, are you okay? Identify her nature of, see how level her consciousness is, would be the APFU scale. Then we would address the life-threatening illness. So it will be a major bleeding. So imagine there's a lot of blood here in the bullet wound. I would then get cut off all of her clothes to where I could see the extremity. We would then try to get that stopped by using dressing. This is the best dressing I could find at Walgreens. So I'm going to put it right here, right in the center of the chest where the bullet wound is. And then this is actually supposed to help her from a possible pneumothorax. So what we're going to do is we're going to hold it in place and tape it so where she might be able to function better. And then you want to put it on this side as well, not the other side completely. That way, if she does have a pneumothorax, this could save her life. Okay, so now that we addressed the major life threats, we're going to identify the ABCs. So it will be airway, breathing, circulation. If her airway's not clear all the way, I would do a chin lift, or a jaw thrust really. And then we would open her jaw up to where it's clear. Assess her breathing with the stethoscope to make sure she has adequate breathing on both sides of her lungs, as well as her back as well, if we can. Identifying circulation as well would be on our distal pupils, distal, the distally over here. And once we do that for 5 seconds, if it's a weak rapid pulse, this is probably not a good sign. But if she is having patent breathing, we would also give her 15 liters of oxygen via non-rebreather mask. Once we figure that out, we're going to identify her GCS scale, which is her Glasgow Coma scale. So depending on that, we would address the priority of the patient, and we would start to transport her as soon as possible. So me and my partner would get a backboard, and we would try to see if we can, once we get that figured out, we're gonna, once my partner is getting the backboard really, I'm then gonna address from head to toe on the patient. So what we're gonna do is, I'm gonna come over here and we're gonna assess the scalp, make sure if there's any type of major lacerations or abrasions in the scalp, make sure she's okay with her neck as well if there's no pain. Open her mouth to see if she has any broken teeth or anything like that. Make sure you get a light to detect the pearl, which would be her pupil.